5 days before the Commonwealth Games, not sure if we are going. Mentally, what that has impact on an athlete, and there you go, and you win a medal for India. Just tell me that story. Over to you.
Thank you, sir. First of all, thank you so much for having me and giving me this opportunity. And to answer your question, to begin with, I mean, I'm not going to sugarcoat it. It's really difficult, and a lot of times when athletes are, they're in great shape, they're in great preparation, even then they go into competitions with uncertainty of, oh, how's it going to be? How am I going to compete? They have so many expectations of family members, themselves, fellow athletes, coaches, and there's so much going on in your mind, even though nothing's going on, but there's just so much pressure that you put yourself in. So apart from that, just anything we just spend a lot of time trying to get our head cleared and not really think about all these things and just focus on what our task is at hand and all the preparation that we've done. So the only thing we care about at that point is to execute what we've done, which takes us a long time to just figure it out. But in my case, on top of that, I had a lot going on in my plate, and I had a lot to worry about and to think about. So to be honest with you, 4 or 5 days before the Commonwealth Games, I wasn't even thinking about the Commonwealth Games. My first thought in my head was, okay, am I even going to get to Birmingham? Because that's step one. If I don't get to Birmingham, then I don't think I'll be able to compete. So for me, the whole process was, and now that we're talking, this is October, first day of October, and it's been a long time. So it just seems like a story when I look back in retrospect. But at that point, I think it's just me and my family who really know what went through my mind and how we were trying to get through that period. And now that it's behind us and it had a happy ending, it's all good. But those 4 or 5 days leading up to Birmingham were really I don't know what the right word is, but were very uncertain in my situation. I wasn't really sure what I was thinking. I wasn't prepared to go and compete.
So that's Tejaswin Shankar for you, one of the best Indian athletes at the moment at the Asian Games with the decathlon. So you heard from TJ, but we also had the opportunity of speaking to Dr. Mala Raj. Shormishta Guptu had a chat with Dr. Raj on a number of issues. Listening.
Counseling, of course, is very important. And as we know now that, mental health is as important as being physically healthy, and mental health plays a very important role in, physical recovery, pre-surgery processes, as you just outlined. And of course, I'm sure you being a woman makes all the greater difference to patients who come to you, because a woman can be empathetic towards another woman. She knows the issues very well. Now, I'd like to come to the fertility part of it. Now, again, we are not specialists, so we know these broad terms like IVF or fertility treatment. But tell us, at what point would you advise a couple or a lady to go in for fertility treatment?
Okay, so ideally speaking, so we give you a time frame of at least a year. Okay, so but then ultimately it all depends upon the age of the couple. Okay, how old is the wife, how old is the husband? So if they are quite young, okay, and they are still anxious that they have not conceived, then we can also give them 2 years of time. But if the age is not in favor of the favor for that couple, like especially if the wife age of the wife, okay, if they are more than 30 or 35, then there are lots of other things we keep in mind about the the number of eggs in the women and all those things. So in such a situation, we do not wait for them to try further. So we tell them if the age is more than 35 to try as early as possible for them to get pregnant. So if nature is not working, then we definitely have to step in and see what best we can do for them. So in that way, we have to offer them all the fertility treatment. So maybe immediately we will not go to the advanced procedure like IVF or ICSI. Initially, we will like to assess how their body is, whether after thorough evaluations, we have to evaluate the male partner, we have to evaluate the female partner find exactly where the problem lies. Okay, whether it is in the women or whether it is in the women, in the man, we have to identify where exactly the problem is, and if it is in the women, where exactly could be the problematic area for that particular women, whether it is in the uterus, whether it is in the tubes, or whether it is in the ovary. So once that analysis is being done, then we decide on the treatment of her. See, suppose if it is the problem is going to be in the tube, okay, then we do not have any options but to suggest them to go for an IVF or ICSI procedure, because the tube is the only passage where the egg and the sperm are going to meet. But if the problem is only going to be in the ovary, or if it is going to be in the uterus, then those are correctable issues. So we can correct the problems which are in the uterus by small surgical procedures like this laparoscopy and hysteroscopy. Or if the problem is going to be in the ovary, then we can again correct them with certain medications like tablets and injections, hormonal injections we can give, and develop the eggs. So ideally speaking, so we understand what exactly is the fertility issue for that particular lady, and we will start with the treatment. So coming to your question, when exactly we start the treatment is like, if the age is more than 35, we just give them a time frame of about an year, and if it is not happening, we move to the next level of either IUI, IVF, or ICSI procedures. But if the couple, if the age of the wife is very less, then we can give another one more extra year, say maybe 2 years or so, and then decide on what exactly fertility treatment we need to offer them.
That was most instructive, doctor, and I hope that couples and ladies who are listening to this show, they get benefited, because it's not every day that we have a doctor talking to us so comprehensively on these issues. So now my final question, doctor, you are not only a practicing doctor, you are also mentoring younger generations of doctors. You are also involved in teaching. So tell us a little bit about that process and how you pass on your experience to, the further generations.
Yeah, so I am very interested in teaching because I know how I learned this skill. It was a very hard journey. Started way back almost 24 years ago, when laparoscopy was not there in vogue. So now we have all been progressing and doing many things, and we are also able to share our knowledge and skills to our junior colleagues. But when I started, things were not as it is now. It was very difficult. So I know how hard it was to learn the skill. And so what I generally do is, like, I have some fellowship programs which are running in my hospital. So I have gynecologists coming over to my hospital to learn these laparoscopic surgeries. They will be with me in my hospital, and when I am operating, they observe. Initially they will observe me operate, and then after a point of time, once I know they are a little bit confident, I will also help them to assist me in the surgeries. Like that, we slowly pass on our skill to our next generation as well. Apart from that, I also take some lecture classes, didactic lectures for these people, like about each and every problem in our the female genital tract. Every issues would be addressed for them, so they also have a very clear picture, concise picture of what exactly is the type of surgery and what they are doing. So in that way, theory classes also would be happening, and also we have something like a module, like a pelvic trainer, where exactly how we are operating in the humans, we ask them to practice it on the training boxes. So they have to, because it is surgery is all about skill, so they have to get the hand, and it's not like an open surgery. So it is like you are looking at the monitor and you are operating down, okay, on the patient. So your hand and eye coordination should be very good. So ultimately, when we are doing a laparoscopic surgery, our brain, our hand, our leg, everything should work together, because we are using our hands to operate, we are using our leg or to have certain other instruments on our foot, like we will have some foot pedals as well. And also we are looking at the monitor to see what exactly is happening inside the patient body. So all this coordination should come. So we cannot teach all that on the patient. So we teach them on a pelvic trainer, which will mimic a patient's body, and on that they keep practicing. So so we have various levels of training. So they have to clear all of that and then only finally come to the OT. So this kind of a process also takes place in my hospital. So I train my junior colleagues also in this particular surgeries.
And more power to you, doctor, because you're working day and night for women's health, for women's physical and mental health, empowering women every day by teaching them and mentoring them. And I'm sure women who are seeing this are increasingly becoming aware that there is no need for, mental stress. There is enough and more medically available to them if they wish to go in for these surgeries or for fertility treatment. So thank you again, doctor, for your time. It was a delight to speak to you. Thank you very much.
Thank you so much. Thank you so much for the opportunity as well.